Okay, welcome to the W3C Community Group call for Wednesday, 2nd March 2022. I'm Timothy Hill of the Open Data Institute, and the topic for this call is going to be safeguarding. It's going to be an unusual call. Most of these calls are reasonably technical, and I'm going to say usually they're fairly well defined as well. This is going to be a little bit different because safeguarding is an area that's both obviously very important in the sports sector generally and to OpenActive in particular, but it's also an area where there are a lot of organizations involved, a lot of different views of what safeguarding actually consists of, and I think a lack of really cohesive thinking in the sector as a whole. So this is going to be very much a kind of landscape definition kind of call, much more than it's going to be about, creating a document, actioning it, and turning it into a technical plan. So yeah, it'll be a fairly far-flung conversation, and we have a lot of participants who are not normally on W3C calls. So I'm just going to go around and ask everyone to introduce themselves in the somewhat random order in which you appear on my screen. So I'll start with Andrew Marshall.
Everyone, Andrew Marshall, Principal Architect at Gladstone Software.
Thank you, Andrew. Michelle.
Afternoon, everyone. I'm Michelle North. I'm the Service Head from the NSPCC's Child Protection in Sport Unit.
Thank you, Michelle. Ollie.
Hi, Ollie from London Sport.
John? Oh, sorry, Rob. Don't know where John came from.
Hi, everyone. I'm Rob. One of my roles at the moment, I'm a physical activity advisor with London Sport, but that's also a role in the National Academy for Social Prescribing with Sport England as well. So, hi, everyone.
Fantastic. Thank you, Rob. Jade.
Hi, I'm Jade Cation. I'm Head of Insight Digital EMD UK and representing Group Exercise Instructors.
Fantastic. Thanks, Jade. The other Tim Corby.
Hi everyone, I'm Tim Corby, OpenActive Engagement Consultant working for the Open Data Institute.
Thank you, Tim. And then I've got two people, both of whom are called Danielle Walker on my screen.
Oh yeah, I'm Danielle Walker. We're both from Barking and Dagenham Council, and we run the social prescribing service. Oh, Jackie, introduce yourself.
So I'm Jackie Hutchinson. So I'm the Service Manager for Healthy Lifestyles and Social Prescribing in Barking and Dagenham.
And also our safeguarding lead.
Okay, thank you. Okay, and this is a voice that we've often not had on calls before, actually, is at that local level. So thank you for joining. David from Everyone Active.
Yeah, I'm David from Everyone Active, Head of IT.
Fantastic, thank you. Kenny Butler, please.
Afternoon all, Health and Wellbeing Lead for UK Active.
Thanks, Kenny. Adam.
Hi all, Adam Freeman-Pask from Sport England. I'm the new Izzy for the time being, so I'm like a caretaker role for Sport England's relationship with OpenActive.
Thank you, Adam. Dave Garish.
Good afternoon, UK Active Strategic Lead for Digital Transformation.
Thanks, Dave. Nicola.
Hi, sorry I'm late. If you can hear any alarms going off, all the electricity's gone off. So I'm on my home phone and I managed to somehow get into this. I work for the Amcraft Trust and we're a safeguarding adults organisation that's funded by Sport England.
Okay, fantastic. Thank you, Nicola. Let's hope your battery holds.
I know.
Chris Norfield.
Head of digital behaviour change at London Sport.
Thank you, Chris. Debbie.
Everyone Active.
Thank you, Debbie. And last but not least, Nick Evans.
Hello, Nick Evans from IMIN.
Okay, thank you very much, everyone, for introducing yourselves and for joining the call. It's a larger than usual call today, but it is an abnormally complicated topic. So hopefully everyone can now see the presentation. Is that right? Okay, fantastic.
Yeah.
So as I said before, asking everyone to introduce themselves, this is going to be a little bit of a nebulous call, unfortunately. because this is a complicated topic that we've looked at before. And I think the conclusion of every previous time we've looked at safeguarding has actually been that we need to widen the focus of the inquiry a little bit. So this is a kind of 30,000 foot kind of perspective that we're aiming at right now, and hopefully we can get closer to operational concerns further down the road. But I would imagine that this will be a tranche of activity that will last over months rather than weeks, and certainly not days. So I think really what I'd like to see from this call, if we can manage it, is first of all identifying who else we need to talk to. The number of organizations involved in safeguarding and with concerns about safeguarding is very, very high. So if we could identify other people we really need to involve in this ongoing conversation, that would be great. And then, of course, identifying some next steps that we would need to concretely do to move forward in getting some kind of safeguarding approach viable for OpenActive. But I'll start with a little review of previous work. So as I said, we've looked at safeguarding a couple of times, sometimes fairly in a fair amount of detail. The first link I've put up there is to a fairly prolonged conversation on GitHub that started in September 2019 and continued on for a fair while. And this was about a very concrete technical proposal that was put forward chiefly by Nick Evans of IMIN, about how you create a trust network, essentially. So the envisaged scenario there is that there is some organization that publishes or is responsible for verifying claims about things like qualifications and things about claims about safety of somebody in a particular position. And that organization certifies other organizations publishing data about the people who are working for them and who are in charge of, say, exercise classes and that kind of thing. It was, and while it is, I think, a good, strong proposal, but it is presupposing the existence of a lot of institutions which maybe don't necessarily exist in the form that's envisaged in the issue. It's sort of a technical first proposal with maybe some of the administrative realities behind it a little bit shadowed. And then a very similar issue came up for discussion about a year later about how we manage private coach sessions and safeguarding issues concerning those. The reflections on those two conversations really boiled down to the point that safeguarding really is an institutional kind of concern. It's the sort of thing that needs administrative, bureaucratic, institutional backing. There need to be people who are willing and able to undertake the work of safeguarding. And that OpenActive as a data standard can't really do much to guarantee safeguarding in and of itself. It can really only do a good job of reflecting accurately the kinds of safeguarding provision that are already in place. So the role of OpenActive in some ways is quite limited. That's not to say that OpenActive can't move forward the cause of safeguarding, if there's a very strong technical proposal and a very clear way of providing the sort of data that's needed for safeguarding. OpenActive can smooth that path and perhaps encourage people or make it easier for people to provide that sort of information and do the kinds of checks that are required for a reliable safeguarding. But in and of itself, it really has to be building on some kind of institutional bedrock before we can really do anything very effective through a data standard. And here is the first point at which I think probably we need some help, because there's lots of activity in the safeguarding area, and it's not, as far as I'm aware, very joined up. There have been in the past various sort of kite marking schemes where various organizations would indeed certify that people were qualified and able and could legitimately work with vulnerable people. Oh, sorry, did somebody want to jump in with a comment there? Sorry, I thought I heard an interruption there. So there have been a lot of schemes in the past, and Sport England has undertaken some work. There's the martial arts safeguarding code that was published. SIMSPA has got a registration scheme that I'm not too sure how that has been progressing so far, but the idea there would be that instructors would register with SIMSPA, and SIMSPA would undertake that kind of certification approach to safeguarding. And then on the ground, as an actually implemented reality, MCR Active, which is an initiative to unify data exchange amongst lots of Manchester leisure centres and activity providers, does have a very nice and, as far as I know, very effective safeguarding design pattern in operation, where people who wish to be instructors are going to be in a position of responsibility, submit their documents electronically online. These documents are inspected by people associated with MCR Active, employed by MCR Active, and they can give a yay or a nay on whether somebody can be considered appropriately qualified for the particular role that they're going to be involved in. The difficulty with the MCR Active approach is that it does require those kinds of human checks, and so it is relatively cumbersome to implement. You need lots and lots of people to actually review these documents and make sure they're processed in a timely way. Those people also need to be trained so that they can recognize, what sort of qualifications are adequate, and so on and so forth. And I suspect that list goes on. But these are just the ones that have come to my attention in the course of these conversations about safeguarding. So I suppose the first conversation I'd throw open to the floor would be, who else is involved in the safeguarding space? Who else do we need to talk to or is working on this question right now? As I suspect people on this call have got a much better idea than I do. Jade, what if I see your hand is raised there?
Oh, thanks, Tim. I just thought from my perspective, it would be quite helpful for us to put into context what we mean by safeguarding and what our parameters are, because we've got, I think, like from what you were saying, you're talking about a mix of sort of maybe qualification. And I don't know if SIMSPA have a specific safeguarding registration scheme or whether it's just qualification. And the manual inspection of qualifications would be about like what qualifications people have got, or like safeguarding, the way that I take safeguarding is about safeguarding of children and vulnerable adults. Yeah, so just some context around what it is that we're talking about.
Sure, thank you. That's another one that I think I'll throw open to the floor. That point has been made before, and I think it's a difficult one because they are quite separable in one way. Are we really talking about ultimately DBS checks and about patterns of behavior, or are we talking about qualification to teach somebody how to do something and make sure that you can look after them in the event of accidents and so forth? Yeah, is it about safety or is it about legal implications? The tentative conclusion we arrived at was that from a user perspective, those things tended to go hand in hand. The question that an end user came to websites with was usually, is it safe for me to send my child or the person for whom I'm responsible to this event? And can I be confident that they're going to be safe there? And that really covers both of those senses, that the user need was a little bit different from the legal need. However, I'm just going to take comments from people on the call, possibly related to that. Chris, you had something to say?
Yes, a very similar point to Jade. I'm wondering to what extent safeguarding is the right term for this particular discussion, whether perhaps some of the stuff we talked about is more quality assurance. And I guess my only input is to reflect on what I've seen from organizations like eBay, Airbnb, when they've gone through this sort of journey from a similar of trying to take all that supply of stuff out there and showcase it to a consumer. They've now brought in lots of stuff, which is essentially around making sure that the end consumer has trust in the thing that they are buying, that it is real, that it's there, and that it is verified. And I guess my only concern around the safeguarding title is that that takes it to almost a bit more of a specific element to it around I guess the safety related to children and young people, or the legal aspect to do with safeguarding. So I just, yeah, we'd be keen to get what everyone thinks, whether safeguarding does cover this, whether quality assurance or something else covers this, and to what extent maybe some differences between those different focuses to what we're doing, and ultimately, yeah, where we should end up trying to find a solution here.
Mm-hmm. Michelle.
Yeah, I guess I have some alarm around someone kind of picking something and saying, well, that must be safe then, because anyone can download a policy, anyone, a lot of people's DBSs are clear. It doesn't mean that club or activity is safe. And I think it's about, rather than that compliance of, has everyone got these things in place? Yes, that is part and parcel, but that isn't what we want people to think about when they're choosing activities, either for their children or for themselves as adults. So I don't, it's really tricky, and I think it's what Jade said. I'm kind of unclear around, is it safeguarding? Is it about helping people understand what a safe club should have, and then being really clear about, if they're uncomfortable, what they can do with that?
Mm-hmm.
So I think there's loads of different, like you've got on there is some examples, but also if the club is affiliated to an NGB, there would be those recommendations, like if it's netball, they've got, is it CAP 21? So there's the different schemes that you would encourage people to look at. But I think it's hard to create safe organizations. It's about how do we empower people with knowledge.
Okay, so there's, let's see, I'm trying to give names to the various different concerns raised. So one is about a distinction between safeguarding in the sense of potentially abusive situations and instruction. Another is about really about messaging, I suppose. Would that be fair, Michelle? That it's about how you communicate what processes are in place, or what kind of confidence you can place?
Yeah, it is. And obviously, there are some, a safer club would have these things in place, but it is about messaging around, if they're not happy, how do they do that? And also, how do they then report back that there's concerns around that particular activity if that's on your scheme? So I think it is about messaging. Safeguarding is so broad, and it can be a bit of a catch-all, so we need to be really clear about what we're saying around that.
Okay, yeah, that's sort of, I guess that was sort of, yeah, the scope problem. Just to pick at that a little bit. So would you see the communication as being about, say, a particular class or facility, or would it be really a much broader piece? Is it really about giving advice to end users, saying, here are the kinds of things you are responsible for checking? Is it more like to put the onus on the end user?
Yeah, I mean, I know, I'm not here to flog CPSU stuff, and it's all free and available on the website, but we have a animation to help parents understand what to do if there's a concern in their club. I know we've got Nicola here from the Anne Craft Trust, and they do a load of stuff on their website around what a safer club might look like. And I think it's more about probably using what's there to empower people to go and do their own checks. As long as you're clear that what you're doing is, if there's an activity here, we encourage them to have safeguards in place, but this is what you should be going to look at, because anyone can send you something that day, and then the next day they've got compliance to be on your site, and it all goes out the door because they've done their compliance, rather than really wanting to embed safeguarding and create safe activity opportunities.
Okay, thank you. Dave Garish.
Hi there, Tim. I'm not quite sure how aware the audience is with UK Active's active standard. So in April of this year, after 12 months of piloting at 40 locations, pulling together an active standard which will support all the comments that we've been discussing here today on how do we ensure and be able to provide even such things as harassment within gyms on the report that we did. How can they go about reporting those, what the qualifications required in order to deliver a certain activity, and so on and so forth. So our head of risk and standards at UK Active for the last 12 months has been working on creating this active standard. And so it might be worthwhile exploring that, because I'm not the expert in it, but our head of risk is, so it might be worthwhile just sharing that, because that goes live to the leisure sector this year across the whole of the organisation. And I know, and if I can just orchestrate just bringing in Kenny, because Kenny's also doing some work with the NHS, and that's into another conversation we've got after this one with the NHS as well on some of the additional work that he does. So if I can pass over to you, Kenny, please.
Yeah, it kind of complements what you're saying, actually. Is there's a project where we're delivering musculoskeletal rehab into our gyms, and that active standard, there's various elements to the active standard. One thing that we would like to have is that Kite mark for healthcare practitioners to be able to refer with confidence for that rehab. And this would be an element, this could be an element of that. If the standards are such that that local operator can bring themselves to that standard. So this could be a way of doing that. And it would be more than just a policy download. So I think there's something to look at with the active standards, which could be sector-wide, like what we're doing. ORCHA, ORCHA is doing for the apps and digital and medical devices. So that ORCHA style accreditation.
There's 4 key benefits to the active standard, and that is to ensure a consistent quality of assurance of its services and products for the public and regulators. The second one is to provide reassurance to customers. The third one is to support the management of reputational risks that occur from such incidences. And then the fourth one is to help the leisure members access new partnerships across the wider health agenda, because they're working to a certain active standard or Kite mark. So that's quite a mature piece of work which goes live in the next month to 2.
Okay. Now, maybe I'll leave my remarks until later, until we've heard from everybody. David Brom.
Yeah, sorry. I just wonder if this conversation's a little premature, in the sense of what we really need is a national standard for this festival. And then once we've got a national standard for how we deal with this, we can then look at how that fits into an open data framework. And it feels like we haven't got a national standard. And yeah, lots of organisations, I mean, we do lots on safeguarding, we do all the good stuff, we know SIMSA, and, we check, we've got DBS for all our colleagues and all that stuff, all the good stuff. But we don't publish this on our website or anything like that. And it just feels like we're just too early doing this until we've got a national standard that we've bought into. And it sounds like there's a lot of good work going on that I wasn't aware of, because I'm not a safeguarding expert, but it sounds like there's a lot of good stuff going on already toward developing that and working towards it and thinking that through. But until we've got that in place, how can we possibly look at that as part of an open data standard? I just think it's a bit premature at the moment. And it's not for this group, it's not for us on an open data forum to be working out what that national standard is it? I wouldn't have thought.
So it's a good point. There's something, Tim, that had been discussed in the past about this authoritative standard or trust standard, or whatever it may want to be called, whereby all the organisations that are responsible for delivering programs for personnel which require a degree of trust in the qualifications, the delivery of the service, the progression of the activities that's being prescribed for their particular need, meets their particular ailment, or whatever the case may be. And then it was brought together in this authoritative standard. So if you had that authoritative standard, you would be working to the standard that cancer care patients require, that diabetic patients require. So, but that was that authoritative standard. And then there's subsections within whatever you wish to actually deliver that you met. And then we got to put then the safeguarding on just the things like sexual harassment and qualifications and all the other bits and pieces into that mix. And that's what we were trying to a little bit do with the active standards. So it's a bit more broader, but then we're looking to try and narrow it down. But David's completely right there.
I mean, I guess what concerns me here is, I mean, is anybody actually attempting to set up a national standard for this? Is that work underway?
From a point of view, I'd ask, there's an active standard that we're pulling together from a point of view of what I've went through there.
Yeah.
But that's the start of this journey. I think now, and then Kenny's working with NHS and also with national, with the social prescribing, with the NASPN personalised care on additional pieces of work. But it's about joining it all up together. But this is the reason why you've called this, isn't it, Tim, to actually pull together this audience to see what we need to do and work collectively in the same direction rather than pull in separate directions.
Yeah, absolutely. I mean, because this is the first I've heard of the active standard, which does sound like the most coherent attempt to address safeguarding as in a kite mark kind of sense of that word. What's the development pathway, I suppose, for the active standard? So UK Active releases it. It's not going to have, what will the official status, I suppose, be of this? Is this something that the NHS will adopt as a conformance criteria?
It's completely separate from the NHS. This is a leisure sector standard to ensure that we support the confidence within those people who don't necessarily participate or those who are currently participating, that we raise the professionalism of the sector to ensure that we meet their specific needs and support them where they need to with a degree of confidence. And this is aligned to the work with Sport England as well across our different strands. So I'm not the expert on it. I've just had that helicopter view that I've given you today, but this is where I'd ask Pete Wells, who's head of risk and standards, who's the person driving this through the partnerships, because again, there's an element of SIMSPA coming in with the qualifications as well at the same time.
Okay, so there's coordination to be done there with SIMSPA and the active standard, I suppose.
If it's relevant, if it's a starting point, or if we need to dovetail into additional standards, it's about taking some direction, isn't it?
Mm-hmm. Sorry, I've got to note that 2 people raised their hands, and I cannot see who those people are. Okay, Dave, raised hand again.
No, it's not me. I need to turn mine off on my phone.
Okay.
Always embarrassed when a digital person can't use it.
So Jade raised in the chat a while ago, about 10 minutes ago, is there a strategic directive for this in terms of what the issue is that needs to be addressed? Well, this is part of the problem, I think, is that a desire for more safeguarding gets raised across a lot of projects. So MCR Active had to take a stance on this and eventually just ended up implementing its own approach to this. Those sorts of region-wide initiatives often feel that safeguarding is something that they need to address. Social prescribing use cases, safeguarding or rather the lack of safeguarding provision in the data standard seems to be like the #1 barrier to social prescribing being a use case that OpenActive can address, or more generally that the physical activity sector is going to find it very hard to be integrated with social prescribing if there's not some means of communicating about safeguarding provision. So there's no strategic directive in the sense that an authority from on high has said that we OpenActive needs to address this. It's simply that it's a need that's been raised multiple times in different contexts. So there's clearly an appetite for it. And yeah, very much bottom up. And curiously, it seems like safeguarding seems to be, if not bottom up, it's not a sort of top level government directive that is coming down for how we approach this. I feel like we've got sort of pulls in 2 different directions, though, taking on board what Michelle said. So it felt like the philosophy that Michelle was really advocating, I take, was that it's perhaps even misleading to be kite marking things, and it's perhaps necessary to shift the onus onto the end user to do these checks for themselves, because assurances could be false assurances, and that the best one can do is really signposting towards information. Michelle, is that a fair reflection of your views?
Yeah, I think so. I think, oh gosh, it was a number of years ago. I know Sport England's funded, I can't remember the organisation, to look at this, almost like a database of, you know, coaches and instructors to try and include safeguarding in it. It's really difficult because depending on the different type of organisation, the requirements and things like that. And I think kind of looking at your site, it's about what influence and power do you have, and you're not going to be able to robustly monitor or check every club's safeguarding provision or whether they are actually doing what they submit. So is it more about educating and empowering people to be comfortable? So yeah, I think it's more that kind of, might be more of the onus for you rather than embedding those kind of kite marks, which can sometimes seem quite tick boxy and compliancy rather than actual safer.
I mean, is there scope for it to be both and, I suppose? I mean, obviously any kite marking scheme, unless it's about something that can be, you know, really formalized, does run that risk that, you know, people can lie, or corners can be cut. You know, is it really about hedging a kite mark, say, and saying, okay, well, you know, we have this kind of certification, we can document what kind of processes lie behind that certification, but there are limits to what we can know. Here are essentially the T's and C's for the kind of assurance you can take from that kite mark.
Yeah, I think there's being really clear that, you know, this is what we're saying, that they should have a safeguarding policy, they should have a welfare officer, or whatever those kind of minimum standards that you put in place. But it is kind of then asking people to really educate themselves around those decisions.
Okay, Dave, I see that you've got your hand raised.
Yep, sorry, 2 seconds, just answering a couple of questions. One of the things, Jade, point you out, Kenny. Yes, it's going back to what Michelle was saying there on there's an onus upon the user, the consumer, what we like to call them, to also do their own due diligence, as well as but we need to make it visible from and I'm speaking from the leisure sector's perspective, is that we need to also make it accessible for them to find that information. And we know from our recent consultation last year that 84% of the leisure sector doesn't have a robust digital strategy that meets the need or is of at this moment in time. 34% don't even have a digital strategy. So this is leaning back to how do we, from a digital perspective, make it available for them to see and to get that level of confidence that when they go to a location, that all the things are in place. And I know this is some further work that Adam's very keen that we look at, as well as with Tim Mathias at UK Active on inclusion, who's our inclusion lead, that we specifically have a digital measure we're measuring each and every year on inclusion, accessibility, and satisfaction. So I think that's something we can take some of your work here into that particular digital measure potentially, to see how we can monitor to ensure that we're staying on the track. So if a kite mark gives you a degree of standard, but we still need to be able to, from a sector, do our side of the bargain to make it as easy for them to find the information as well. So we can pick that bit up as well.
Okay, thank you, Dave. I mean, it sounds like one of the next steps coming out of this meeting is review of the various safeguarding codes, but particularly Active Standard, to look at what a digital representation of that would look like, and also what the appropriate way of communicating the limitations of that exercise are to end users. There's a kind of sifting, I guess, that we'll need to do to see how we can flexibly communicate to end users the safeguarding risks attendant upon an activity. You said that's going to be published in a couple of months' time?
This is what, sorry, the report?
Yeah.
The report was published in December from our consultation last year. It's not a problem. It was the first one, but we are looking now to work with other organisations to ensure that we take the consultation to the next level, when we're actually supporting the leisure sector, make it as easy as we possibly can to increase participation.
Okay.
And there's going to be some consumer surveying as well that we're looking to do, and that will be a continual periodic consumer survey of the UK membership base as well.
Okay, Jade.
Thanks, Tim. I was just having a little chat with Dave offline because I just wanted to understand. The piece of work that UK Active are doing, as I understand it from Dave replied to my question, is for operators. Yes, that is a big part of what we're talking about. But I think Chris put in the chat as well, that is a part of the solution as well. And someone said earlier about, and I agree, I don't know where we're trying to get at this and whether we should be wasting resource until actually there's nothing there that covers what we need from an open data perspective. Like the UK Active is for operators, SimSpa do stuff for some individual fitness instructors. This is literally a crazy subject that we're talking about, and I just feel like I don't know that it doesn't really feel like that we're ready or it's the right time for OpenActive to start trying to put something in place.
Yeah, I mean, I think that's been the case for the last 3 years. I think, and I'm going to voice some frustration here, I feel like there are always two simultaneous calls with safeguarding. One is that somebody should definitely do something, and the other is that person should definitely not be any named organization. It's a clear need that's often demanded, but it's very hard to identify who would be in charge of it and when coverage is kind of adequate. So, it is completely an option for OpenActive to say this is something that we just can't touch because we're not qualified to and it's too big. And that is, fine, and perhaps simply a reflection of the state of play. We can also then just resign ourselves to a continual chorus of, we need safeguarding provision. Why isn't somebody in charge of safeguarding? What is being done about safeguarding? Why aren't you addressing safeguarding? So I suppose, if we make a strong policy, this is something we don't touch until a national infrastructure has been created, and then we reflect it. Maybe we do it that way. Sorry, Rob.
Yeah, just sort of trying to compute everything. And it's interesting, because in the case of social prescribing, of course, it developed organically. And in many conversations you can have about social prescribing, it said, oh, you shouldn't over systemize it. It's about relationships between people. And of course, the NHS has come along and systemized it. And, there is that difference between issues that you should take responsibility for if you're making a referral as part of a recognized process to do with medical conditions. I think that's largely the stuff that UK Active's dealing with. Correct me if I'm wrong, but it would be interesting to the extent that the NHS have systemized social prescribing, the extent to which safeguarding is dealt with, given the coverage that the NHS social prescribing network has, as being a closest proxy to the kind of reach that, because social prescribing obviously goes beyond sport and physical activity and largely does probably deal with people who might be classed as vulnerable, or to a good extent does. So that might be a good proxy. And it'd be interesting that, Dave, and I don't know whether you're going to, the extent to which this has been picked up, the difference between safeguarding and kind of accreditation relative to catering for people with medical conditions. Just to throw that out there, yeah, what do people think about that? In other words, the NHS view on this whole subject.
Yeah, Bob, sorry, go on, Dave.
No, please, Jade.
I was going to just say, like, it feels like it needs to be compartmentalized a bit more, and I think that's like what I was taken from what Rob was saying, and I agree. Like, we've got safeguarding in terms of children and vulnerable adults, and there's aspects there that could be looked at. There's sort of regulation in terms of the qualifications and training, and then there's the medical standards. And I think that OpenActive need to prioritise one of those things and look at what focus on one of those things and look at how bringing that forward.
Right, so it's about splitting it into kind of 3 use cases, and yeah, do one, not all of them at the same time. That's okay.
Whilst I was just going to say, whilst being cognizant of, obviously you're right to be cognizant, because in some way OpenActive brings that coverage, and in the way that it collates information, there's obviously a sense of responsibility that is felt in doing that, because people can pick up information anyway through the internet, can't they? But because OpenActive are in some way making it easier for people to find information, there's a sense of responsibility felt there. So I suppose it's juggling what you can and should do, and just being sure that what you need to be aware of is as in on the agenda as it should be, sort of thing. And there's a shared understanding of the most important parties, I suppose, that are working in this area. Sorry.
Yeah, and I think there's a kind of negative risk here. Now, Nick can jump in and correct me if I'm wrong about this, but I think in the case of MCR Active, there's a kind of warning attached to open data because we don't have that kind of safeguarding process attached to it. So it's, not a warning exactly, but it's sort of, this is unverified. Our safeguarding checks have not been applied to this because we can't, which I would imagine does sort of drag down the appeal of those opportunities. So I feel like if we're kind of hampered by that, it could be a real problem for open data, that we're always sort of the less safe or less perceptibly the clearly less safe option.
Yeah, I can speak a little bit to that, which is I think all the in many cases those that are currently using open data have some kind of disclaimer that basically says this is stuff you find here is as safe as stuff you find on Google, so treat it as such, kind of thing. This is the internet almost. And that's obviously, that works in the sense of, we are really, OpenActive does solve a problem in terms of, when you've got the motivation to be active, whatever that medium is, you've then gone and found the thing. You found a thing in a way that would have been much more complicated had you not got access to that information through the OpenActive infrastructure. So it is still solving a core need. It's just when you get to that thing, you have the same thing as if you found it on Google through whatever other longer means of doing that, which is that you then need to check it, which I know was kind of mentioned earlier. So I suppose we kind of already are in the position where we're saying people should check their own stuff, and that does get us somewhere with safeguarding, because obviously it's important to make that clear. And I think the next level to this is probably when we had talk to folks like MCR Active or Change for Life, when there's brands involved, they would like to be able to say this is something that's safe because it's on our website, and obviously that's the small difference. So obviously with MCR they can say, yeah, we can verify these things because we've manually checked them, and that's where they're able to say this is safe from our perspective and it's on our website, so you can trust us and trust our brand. So I think But I think depending on what infrastructure we put in place, I suspect every brand is going to have to make that decision. Depending on the strength of the assurance that we have available within the infrastructure, it might work for MCR, it might not work for whatever comes after Change for Life, because everyone's brand, they've got to consider whether they still even need that warning. Okay, we've actually added this additional mark that you can use, but actually that mark has, you still got to check it, as Michelle mentioned earlier. So it sounds like that disclaimer just gets slightly shorter, basically, and there might be a lot of work to do that. So maybe it's worth digging into other use cases where we're not just talking about the size of the disclaimer, but things like social prescribing, where it might make a real difference to the pathway.
Right. So, I mean, sorry. So I feel like that's a more nuanced restatement of again, sort of saying we need to divide this up into use cases and address the ones that are most urgent, and with further consultation, and we can deprioritize others for the present. Is that fair?
Sorry, yeah, yes, I was. It was giving the kind of context of what's currently happening on top of it. But yeah, I wasn't suggesting we do anything different than what you're saying. Yeah.
Oh yeah, just wanted to be sure about that. Okay, cool. And then we've got a point. So that's almost sort of the demand side. Is what is the use case that this is satisfying? What are end users expecting? If there's link workers in the mix, what are they expecting? And then from Chris Norfield in the chat, we've got the comment: are we likely to ever have a universal standard that covers everything, or more likely to have multiple types of schemes or assurances that could be displayed against a particular session or provider? Which is kind of the reality we've got now, right? That you'll have various local kind of schemes for a particular sector, a particular activity, or NGB or whatever, and there isn't any kind of overarching standard for that. And then I suppose it becomes a question of, in standards terms, it's about, I guess, having a very general purpose kind of field or fields, saying, here's the relevant thing to consider. And it would be hard to parse. It would be difficult to build a consuming system for that, but perhaps that's just the reality that we have, that approaches differ, and we just have to reflect that amorphousness in the data standard, because that's what we can do. Chris, does that sort of reflect your concerns there accurately?
Yeah, I guess it's just the worry about waiting until we have a clear national picture, is that it may never come. There may never be this one thing that answers all our questions. There are more likely to be opportunities to utilize existing or new assurance schemes, or those opportunities, and how they might then feed into the OpenActive standards and then be displayed on a front end. I guess my only other thing to add is, again, from the examples of other data-based businesses, is that they are more and more reinvesting back in manual checking of stuff, and I think we probably don't want to go down too far the route of trying to automate everything and just say we're never going to have the capacity to do it manually, when actually it may be important to have a manual aspect, whether that is very local and regional or a more national approach. But it's just, I guess, worth considering.
Okay, so yeah, I guess what that really points to is really flexibility. That on the one hand, there's lots of different schemes, so you have to be able to communicate that flexibly, and some can be very, very fine-grained. It could be like MCR Active, that actually you've got a very well-defined infrastructure in place with very clear criteria that they judge against, and you have to be able to communicate that. On the other hand, if you've got a much more open-ended system, you'll need to be able to communicate that actually there's not very much structure there, or the advice that you're giving isn't particularly meaningful because it doesn't have a big infrastructure behind it. So there's a real range that will have to be covered there. Okay, we've only got 7 minutes on the call, and I feel like there's several actions, all of which are on me in the first instance. The first, I think, is to be more specific about the use cases that are that are being discussed. There were 3 that were tentatively identified earlier, and I suspect when I review this call, it'll turn into more like 5. The second would be to review the active standard and other work ongoing in this area to see what a communication framework would look like. Another would be to pick up with Michelle about the advice that's currently given and how we can easily link to that in the most relevant and user-friendly way as a fundamental means of safeguarding or of helping to educate end users. I think that's all on me. The other one would be to write up this call and circulate it to all of you and get your comments on it to make sure, well, to provide a space for further reflection, first of all, and then secondly, just to make sure that I've represented your concerns adequately in the document. So that's what I'm going to do. I'll just throw it open to the floor, though, for the last 5 minutes, just to get general comments and concerns that maybe haven't been addressed yet. Or has everyone said their piece?
I was just going to say, I'm now on a laptop rather than on my phone, and I've sort of caught up a little bit, but we can provide some information from the Ancraft Trust around safeguarding adults in sport. So we work quite closely with the CPSU. So if you wanted us to be added to that, then please add us. Okay, cool. That's great. I will consult with you for that, as well as with Michelle. And one point that I'll pick up on also is, I think I'd like to have one place where all of these materials were gathered together so that it's visible to everybody with safeguarding concerns. If you can make clear where you're not happy for materials to be shared, that would be really good. I'll reiterate that over email, but if we could share as much as possible and get the conversation out in the open, I think that would be really good. Okay, I think that's everything from me then.
Tim, sorry, I just had a quick query. In the case that Nick was talking about, and you're talking about MCR Active, is there a scenario where you could have a situation that would allow them to use open data, but that the open data would only become sort of visible once it had gone through, in the case of localities like that, if that was the thing that was stopping them, that would allow them to have a filter that would enable them to do the manual checks that they felt necessary, that would still allow them to use open data, but at the same time enable them to do the manual checks, if you like, that so there was a sort of drawbridge, if you like, a moat or whatever. I don't know, because it's a shame if you've got localities who are not using it for that reason, and an open data somehow can be amended so as to not restrict them, but also allow them to do what they feel they need to do. I don't know if what I've said makes sense, but
yeah, I think it's probably worth clarifying what I said there. That MCR are using all data. It's just that they have a disclaimer on there, as others will do.
Right.
Okay. And there is another mechanism that they have for assuring certain data sources. And the conversation, I think, what the GitHub thread in 2019 was doing, and it was saying if organizations like MCR are doing assurance, we could do that using a standard approach. So other people could pick up the MCR stamp and put that on their website and things like that. And I think where that fell down is, as Tim mentioned at the beginning, MCR are keen to do that kind of assurance, but who else is doing that? And if there's not like a number of organizations doing it across regions, then we don't have, without someone rubber stamping, there's not much point standardizing it. And whenever we've gone out for a call to say, who else is rubber stamping other than MCR? No one else seems to be doing it. It used to be club something that Sport England had for a while.
Club Mark, perhaps.
Club Mark, that's it. And so you know, is it the case that now that's moved to NGBs because Sport England isn't doing it centrally, that can be done in individual NGBs, and then how does that all work? Was kind of part of that conversation. But it sounds like we've, yeah, and that's definitely something that could still be done, and that's surfaced. But that's almost like another, I don't know, another consideration for the same problem, maybe.
Thanks.
Yeah, I feel like that sort of stamping kind of approach, it kind of comes and goes depending on resourcing levels, unfortunately. So it's certainly not a sort of stable resource you can build against a lot of the time, because it takes funding. So it's good while it lasts. Okay.
Yeah, and it's worth saying as well that kind of approach, I believe, in some NGVs has been kind of automated as much as possible. So I'm not sure what value it adds in the sense of, does it actually do the checks? I don't know, but that's just a question to ask in terms of verifying that. Should anyone watch this back and think, oh, we could go down that route, it might be worth just checking that the checks are worth it.
Yeah. Well, this is the problem with these kinds of digital representations. I mean, what are we actually representing? Okay, thank you very much for that. I think this is going to be a long and tangled conversation, and I think probably it'll be about addressing particular use cases as usefully as possible over time, rather than the giant safeguarding title being satisfied. But I'll pick up with various people after this call, and I'll be in touch regarding any further steps that we take along this. This hasn't been identified as a tranche of work for OpenActive to solidly focus on, for the next 3 months or anything like that. But the requirement is a very steady one, so we will be iterating on this. And with that, I will thank you very much for joining the call. Thank you all for your contributions. It's very hard to get a sense of this terrain. And I'm glad that there's a lot of good work that has been done and is about to be done in the area. So thank you very much, and talk to you all later.
Thank you.
Thanks, Tim.
Thanks a lot.